Cultural competence is incredibly important in clinical work when you're dealing with patients, irrespective of what their culture is. Cultural competence basically is good clinical practice. It is putting the patient at the heart of everything you do. Patients like you are surrounded by culture, their family, community, and culture as a whole. And patients respond to that as do clinicians. One of the major challenges for clinicians is to be culturally aware. In order to be culturally competent, you need to have cultural knowledge, you need to have cultural empathy, you need to have skills to make sure that patients are in tune with what you're asking them and what the patients are telling you, because that will be very strongly culturally influenced. Being aware of the strengths and the weaknesses of the culture is absolutely vital. Everybody has prejudices, every culture has strengths, and every culture has weaknesses. So the first step any therapist has to do and look at is their own personal cultural strengths and weaknesses, which allow them to engage with the patient in a much more empathic way. It also means that you can engage the patient better. Sometimes patients from different cultural backgrounds may be frightened of seeking help because their explanatory models may be different, and they may feel the clinician A won't understand it, B criticize them for holding those explanatory models, such as in psychiatric disorders they may feel that they are the victim of an evil eye. So recognizing the patient's explanatory models and recognizing that they may well differ from the medical or biopsychosocial model is important, and the clinicians need to acknowledge that difference, but also try and find a common ground where patients would be happy to see the clinician, get the right assessment, get the right diagnosis, and get the right treatment. Understanding one's own prejudices, one's own weaknesses and strengths, and one's cultural strengths and weaknesses also can help improve that process of engagement.